Preparing for adulthood. Taking charge of my own healthcare. Who helps you coordinate your healthcare?
My mom helps me in ways. I guess I really don't fully understand. I don't keep track of anything related to my healthcare.
Would you like to?
Eventually.
My mom helps me with my healthcare. She's always there, even when sometimes I don't want her to be. But most days I'm really thankful, especially when it comes down to what I need to do, and she usually shows me the ropes. We went to go get a shot today, and had no idea what to do, so then my mom was like, well, just sign here. It actually went pretty quick. It was pretty easy. It was a little nerve-wracking because, the doctors and nurses were staring at you like, hurry up, we don't have all day. But it was nice to have my mom at least by my side and telling me what to do, put the date, print my name, sign my name, and cursive.
So now that I go to an adult doctor, I am coordinating my own care. I make my own appointments, I schedule them, I make sure I get there on time, and I write a list of questions on why I'm visiting there, if it's a checkup or I'm sick, and I find out what could be wrong with me. I ask the doctor. I have a list of questions in my phone, so I can ask them after the appointment's over to get answers and to be able to write down what they say so I can actually remember. And I call the nurses and make sure that all the medical records are sent to that doctor that I'm seeing that day.
My dad is usually the one that coordinates a lot of the healthcare, and he takes all the mail for me, basically. So if I ever am, struggling with the panic, he takes care of, signing everything and paying for it, and then all I have to do is focus on me and taking care of me and nothing else. Well, usually at the doctor, I'm the one asking the questions, but, my dad just deals with the stuff we get in the mail.
Mom usually sets up my appointments. She does the copays, she calls in, but I'd really like to take some action and do it by myself. I want to be able to set up the appointment, know how much I need to pay for a copay, and take more responsibility and not have my mom do everything. But right now my mom's been helping me with everything. But slowly and slowly, as I have more appointments, I'm going to take action and start talking on my own or start scheduling the appointments, because I never knew you can call in, and as a teenager or even as a young adult, because that's just what a mother's job to do, and I'm just afraid that I won't have her in the future and I need to be my own mom, I guess. So, yeah.
Care coordinators can schedule appointments, seek information, resources, and solutions to problems, handle prescription refills, coordinate coverage with insurance, develop a plan of care, provide organizing tools, help coordinate school services, provide input for IEP and 504 meetings, advocate for patients and families, provide referrals, education, and resources. Ask your clinic if they offer care coordination services.